Assalamualaikum. In today's video, I will be telling you about the artery supply of the heart. So, the main artery that supplies the heart is the coronary artery. And this is the very important question for your written as well as your viva. So, here I covered the both the things, both the written and the viva questions. So, let's start without wasting much time. The coronary artery, it is a, which type of artery? It is a distributing vessel or the muscular artery, I can say, and it is also a functional artery. Then if you are giving the viva, then they will ask you, okay, what is the functional artery and what is its importance? Then this coronary artery, it arises from the aortic sinus. Now, what do you mean by aortic sinus? It is the beginning or the dilatation of the ascending aorta. Okay, so we clearly know the ascending aorta is something like this, and here we have the branches, three branches. Okay, brachiocephalic, common carotid, and subclavian. So this is the beginning and the dilatation of the ascending aorta. So this will be your aortic sinus. Okay, then it is a branch of ascending aorta, and last thing is it is the vasa vasorum of ascending aorta. Now, what do you mean by vasa vasorum? Vasa vasorum means vessels supplying vessels. I repeat, vasa vasorum means vessels supplying vessels. Okay, so coronary artery, it is what? It is the vasa vasorum of the ascending aorta. Now, aortic sinus. Okay, so these aortic sinus, these are three in number. In the anterior side we have the anterior aortic sinus. In the posterior side we have two aortic sinus, the posterior right aortic sinus and posterior left aortic sinus. The anterior aortic sinus, it gives rise to the right coronary artery, and the posterior left aortic sinus, it gives rise to the left coronary artery. So this is the basic model. We will go further inshallah. Okay, now let's see. It is a diagram of the heart I've drawn over here. Obviously, further I will tell you the branches, origin, termination, and distribution of the right and left coronary arteries. So, okay, one more thing, that in the examination they will ask you, okay, how many coronary arteries are there? Then you have to say there are two coronary arteries, right coronary artery and left coronary artery. Okay, so here you can see this is the right atrium of the heart, right ventricle, left atrium, left ventricle. Okay, so this is the atrioventricular node, this is the sinoatrial node, and this is the aorta, and this is will be the aortic sinus, this is the pulmonary trunk. Okay, so this in the blue I have drawn the branches of the right coronary artery, and in the red I have drawn the branches of the left coronary artery. So the branches for the right coronary artery, what will be? See, it is supplying the sinoatrial node, so you can say sinoatrial nodal artery. Okay, or just you can say arterial branch. Okay, so one thing you would like to know over here is that this sinoatrial nodal artery, okay, it is a branch of right coronary artery, right? So it supplies, in 60% cases, it supplies the sinoatrial node, and it is a branch of right coronary artery, and in 40% cases it is a branch of left coronary artery. See, I have drawn a very light red mark over here. Okay, so this is the branch of the left coronary artery. Okay, then it also supplies the atrioventricular node, okay, in 80 to 90% cases. Some books says 80% cases and some books says 90% or 85% cases. So I've written over here 80. So in 80 to 90% cases, the atrioventricular node, it is supplied by the branch of the right coronary artery. Okay, then you also have the marginal artery, right marginal artery, which is acute in nature, or you can say acute marginal artery, and posterior interventricular branch. These are 2 to 3 in number. That is, see, I have drawn here dotted lines. It means it lies in the posterior part of the heart, or I can say posterior surface of the heart. So posterior interventricular branch. Okay, it also is having some septal branches which arise from here like this, which supplies the interventricular septum. So obviously in the further lecture I will tell you about the distribution and the branches. Okay, so these are the basic things. It supplies the sinoatrial node through sinoatrial nodal artery. It supplies the interventricular septum, so it will be the posterior interventricular branch. You have to say posterior interventricular branch. Okay, it is also having a branch named as right marginal artery, and it also supplies the atrioventricular node in 80 to 90% cases. Also septal artery. Now, the left coronary artery is having some branches. The most important are the two branches. These are the circumflex branch, okay, and the other one is the anterior interventricular branch. Okay, I will mark it as like circumflex branch, anterior interventricular branch, and also left marginal artery, because it supplies the almost left margin of the heart. That's why. So See, the circumflex branch means, what do you mean by circumflex? It is, as you know, when we learn about the circle, we know that there is a circumference. Okay, so circumflex means which rounds about something. Okay, so most of the branches over here are the circumflex arteries branches. For example, the artery to sinoatrial node. In the 40% cases, it is a branch of circumflex branch of the left coronary artery. You can say. Okay, then other branches of the left coronary artery are the left marginal artery, which is obtuse, then anterior interventricular branch. Okay, so as you can understand over here that when I've written posterior interventricular branch, that means it will supply the posterior part of the interventricular septum, and the anterior interventricular branch, it is the branch of left coronary artery, so it will supply the anterior interventricular septum. One more thing that is very easy and you need to know is that the right coronary artery, it will mostly supply the right side of the heart, and the left coronary artery, it will mostly supply the left part of the heart. Okay, now you will need to know about the coronary dominance. Coronary dominance means in 89 to 90% cases, the posterior interventricular branch, it is a branch of the right coronary artery. So we will say, okay, there is a right coronary dominance. Okay, but when this posterior interventricular branch, it becomes the branch of the left coronary artery, which occurs in 80% cases. So it is called as left coronary dominance. Okay, so this is it. In codominance, it occurs in 3% cases, where posterior interventricular branch, it arises from both right and left coronary arteries. Here we have seen about the coronary artery, which type of artery it is, and something about aortic sinus, and we have seen through the diagrams. Now I will show you in the written part. Without wasting much time, let's start with this right coronary artery. As we know that coronary artery is a branch of the ascending aorta. So right coronary artery, it basically arises from the anterior aortic sinus of the ascending aorta between the pulmonary trunk and the right auricle. Okay, and it terminates at the crus of the heart by anastomosis with the left coronary artery. So this thing is common for both right and left coronary arteries. They basically anastomose with each other at the crus of the heart. Okay, so then distribution. This right coronary artery, as we know, it is right. So it will mainly supply the right part. So it supplies the right atrium, whole right ventricle, part of the left ventricle, very little part. Then sinoatrial node by the sinoatrial nodal artery in 60% cases, and atrioventricular node in 80 to 90% cases, and the posterior part of the interventricular septum. This thing, it obviously comes from the posterior interventricular branch, as I told you in the previous video. So you can relate it with the opposite nature. The posterior part of the interventricular septum, it will be supplied by the right coronary artery, and the anterior part will be supplied by the left coronary artery. Now the branches. The right coronary artery is having the branches, the right conus artery, the arterial branches, that is sinoatrial nodal artery, posterior interventricular artery, anterior posterior ventricular branches, marginal branch, and segmental branch. Now I will tell you about the left coronary artery. It basically originates from the left posterior aortic sinus. We know in the posterior part there are two aortic sinus, right and left. So it basically originates from the left posterior aortic sinus of the ascending aorta behind the pulmonary trunk, and it terminates by anastomosis with the right coronary artery. But here is the thing that I already told you in the previous video, that circumflex means something which is rounding. So the circumflex branch, it basically anastomoses with the right coronary artery. So there is the anastomosis of right and left coronary arteries, but in the left coronary artery, the branch is the circumflex branch. Now the distribution, as it's a left coronary artery, it will mainly supply the left part. So left atrium, left ventricle, part of the right ventricle, and sinoatrial node in 30% cases, atrioventricular node in 10 to 20% cases, and anterior part of the interventricular septum. The branches of the left coronary artery, as I told you, the most important branch is the circumflex branch. So circumflex artery, anterior interventricular artery, diagonal artery, conus artery, and arterial branches. So that's it for today. Hope you like it. Please do like, share, comment, and subscribe. And please do write in the comment section if you want the notes of these, or if you want to know the course of the right and left coronary arteries. Thank you.